Dr. Mads Gilbert, Professor of Emergency Medicine at the University of Tromsø in Norway. Now, he has worked for many years, for perhaps 20 years, training Gaza doctors and medics to try to deal with some of the situations that they are facing now. Mads, I will come to you on the subject of Gaza, of course, and your reflections on the past year. But I know that right now you're in Lebanon, where Israel is continuing to fight its war on a second front. So perhaps first you could just tell us what you've experienced since you've been there.
Yes, thank you. I'm now in southern Lebanon, in Nabatiye, in a small local hospital called the Nabatiye General Hospital. I've been there for a week, and we have had a steady stream of wounded and dying and killed. Yesterday we had 9 wounded, 2 died in our hands from the injuries from the Israeli terror bombing. Today we had 2 young people. One was impossible to save. The other one was operated on. And there is a constant barrage of bombing, of Israeli terror bombing around the city of Nabatiye, and south, of course, towards the Litani River and the border between Lebanon and Israel. It is incredibly difficult to organize the healthcare work because the attacks on healthcare in Lebanon have been as bad as the attacks on healthcare in Gaza, and all the 5 local hospitals south of the Litani River have been forced to close down due to Israeli attacks. So we are actually now the first of 3 local hospitals in Nabatiye receiving the wounded. This also means that those who are wounded south of Litani will have an extra hour to get to the first point of medical relief. Today, the Israelis bombed one of the fire stations south of Litani, killed 10 civilian firefighters, and they killed also 7 paramedics. So the slaughter goes on, the terror goes on, and people are, of course, extremely exposed to this terror regime.
And no doubt people there are extremely worried that Lebanon may well turn into the next Gaza. From what you've seen so far, how does it compare?
Well, I've been here before. My first medical solidarity mission was to Beirut in 1982. So it's 42 years since, and I'm sad to say that not much has changed when it comes to the brutality of the Israeli attacks on the civilian society, be it the suburbs of Beirut like Haret Reik and Fakahani and Deisha, and also the attacks on healthcare, as I mentioned. So still, Lebanon has a better situation than Gaza because the siege is not as bad as on Gaza, of course. So there is water, there is food, there is medical supplies, and nothing really compares in the world today to the situation in Gaza after 16 years of siege and now 12 months of relentless, merciless, genocidal bombing. Of course, it's very important that we do not forget to increase the demand for ceasefire in Gaza, because the situation there for the healthcare system and for the civilian population is totally unbearable. Still managed, but I'm afraid that the attacks will be stepped up, and I'm very concerned about the increased bombing of Beirut.
And of course, you'll be reflecting on what's happened in the last year in Gaza, as you have just been. I mean, few people would have expected when this all kicked off 1 year ago that it would still be going. But the stark truth is that in this past year, there's barely been a day in Gaza without death or destruction, and that is still happening on a daily basis. You wonder how people are coping.
You wonder how people are coping, and the 2.2 million people, bear in mind half of them children, have shown a remarkable sumud or resilience or steadfastness. I think the Israeli occupation forces and the Israeli government have as a goal to break down the moral and the coherence in the Palestinian society in order to execute their ethnic cleansing and chase people away from Gaza. But the Palestinian people, both in Gaza and in the West Bank, and by the way, in the diaspora here in the big camps in Lebanon, they stand steadfast, they stand tall in their resistance and in their struggle for a national independence. I mean, I'm a doctor. I'm not trained to treat symptoms like pain. I'm trained to find the root cause. And the root cause, as I see it, of all the misery in the Middle East, in particular in Gaza, West Bank, and Lebanon, that has to be brought to an end before we can have a final, lasting solution for the Palestinian and the Lebanese people.
Mads, we thank you very much, as always, for joining us on the News Hour. Dr. Mads Gilbert there joining us from southern Lebanon.